Hello everyone, welcome to my channel. Today we have another pediatrics question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 3-week-old female infant is brought to her pediatrician because she has been having infrequent bowel movements since birth. Her parents report that she passes a hard stool every 3 to 4 days, and her first bowel movement did not occur until the second day of life. She is exclusively breastfed but often stops feeding after only a few minutes and seems unusually sleepy. Despite feeding every 2 to 3 hours, she has not gained any weight since birth. She was delivered at full term in an uncomplicated home birth, and her mother did not receive prenatal care. On examination, the infant appears quiet and lethargic. Vital signs show a temperature of 36.2 and a heart rate of 98 per minute. She has a large anterior fontanelle, coarse facial features with preorbital puffiness, mild generalized hypotonia, and persistent jaundice involving the face and upper trunk. The abdomen is soft without palpable masses or hepatosplenomegaly, and bowel sounds are present. Digital rectal examination reveals normal anal tone without explosive stool passage. Which of the following is the most appropriate next step to confirm the diagnosis? First things first, we need to think about the diagnosis. Uh, the patient had delayed passage of meconium because it happened after 48 hours of life, and in addition to that, she seems to have decreased gastrointestinal mobility, and she seems to have low levels of energy because she falls asleep, so she's lethargic. And looking at her heart rate, she's borderline. She has a low heart rate, but that's very borderline. But that could contribute to the fact that she is lethargic and she has hypometabolism. In addition to that, she has a large fontanelle with coarse facial features, and all these combined could indicate congenital hypothyroidism, especially the large fontanelle as well as the puffiness. With that being said, let's go over the answer choices. A, observation without routine follow-up. No, this is not a good option, because if she really has congenital hypothyroidism, if we do not take any actions, inabilities in the future for the child. B, serum thyroid stimulating hormone and free thyroxine levels. Well, this could be helpful because with congenital hypothyroidism, we would expect the TSH levels to be high and thyroxine levels to be low. So this could help us make that diagnosis. C, rectal suction biopsy. We do rectal suction biopsy for Hirschsprung disease, but that's not likely in this scenario, because with that disease, we see some other severe symptoms such as bilious MSS, as well as uh, abdominal distension, which we are not seeing here. Sweet chloride testing, we use that for cystic fibrosis. Cystic fibrosis could lead to many of the symptoms we are seeing here, but the large fontanelle and puffiness are not symptoms that we see with this disease. Contrast enema is basically doing an x-ray of the colon, and that's not helpful in this case, because there are other symptoms that are related to colon obstruction, and large anterior fontanelle and puffiness are not one of them. And also there are some other severe symptoms with basic obstruction that you're not seeing here. And with that being said, the best answer choice is B. Thank you very much for watching, and don't forget to like and subscribe.